Good morning. I want to give you guys an update, a COVID-19 update. There's a lot going on. Everything I reference will be posted to our website by midday today. The best resources to check as we go through this, as we make our way through this, is the Department of Health resources, Arizona Department of Health Services, and also the governor's office if you choose. First and foremost, we have asked the governor a couple times to lift the licensing requirements, meaning that DCW and CNAs would be able to flow back and forth among all the different parts of care. We have not received that executive order yet. We checked Friday and there's a rumor that it will get done, but it has not gotten done yet. Please don't loosen the licensing requirements until you hear something from us. And don't listen to rumors. There's so many rumors taking place out there, you guys. If you're not sure, email me, kbarno@azalpha.org. Call me, 602-322-0100. If I'm not here and we are working a lot remotely, I can be reached on my cell phone, which is on my voice message. Check the source before you run with it. There's a lot of rumors going on out there about, communities that have positive results and communities that don't. You guys, we are all in this together. And if you're blessed and your community comes out of this unscathed, that's fantastic. And I am so happy. If you're not, and if you get a positive, it's gonna happen. So don't talk amongst yourselves, bad-mouthing or just saying things, because we're in this together. Your caregivers talk, they go building to building to building. So just realize that everybody's here to do resources. Everybody's here to support one another. So let's get support done. The first thing I want to talk to you about is if you have to prevent the spread within your communities, your infection control has to be locked down. You guys have got to be on point with infection control, because that's where everything's going to begin and end. Make sure you have your PPEs, your gowns, your face guards, your mask, everything that you need to take care of this. If you have a resident that does have a positive and you have to isolate them, they get isolated to their room. If you have a couple residents that are positive, you may have to cohabitate them. You may have to put them all in one room or one apartment, all in one apartment to minimize the impact. I think all of you guys are serving now in resident rooms. You've cut out activities, you've cut out transportation. But as we move through this, like I said, it's going to be a changing field. So make sure that, you protect the spread within. If you have a resident that does taste positive, do not forget to notify the health department. You could let us know, but it's not mandatory. Just kind of give us a feel. We have the board of Arizona Alpha voted Friday. God, Friday was only 2 days away. Wow. Voted Friday to bring out a public relations company. So Krika Media, and I know I'm doing her name wrong. Sorry, Susan. Media is our new PR firm that will help guide us through this. I also know most of you guys have your own firms, but don't forget to notify the health department. Follow CDC recommendations on PPE. Keeping in mind, CDC's recommendations on PPEs keep changing. As we develop more and more shortages of them, things are getting, kind of loosened to help providers out. Obviously, use universal face mask. As I said, don't forget to have them share a room if they have to. If a resident is ready to be discharged back from the hospital to their community, you should accept, regardless of whether they are still potentially infectious, as long as the facility can follow appropriate transmission-based precautions. Priority placement with the original community will be taken into consideration, but that may not happen. I kind of find that is for residential settings, so I don't know how they'll handle that, because they're the residents' apartments. So you may have to bring in some positive residents that are returning from the hospitals, especially if the hospitals are going to try to empty out their beds. If this gets to a catastrophic level. So far, I think we only have, and I don't mean only, I'm sorry, I don't mean that. When I think of New York in comparison, we have, I think, 1,100 cases so far. We have been talking about this for a while. I have been saying that we expected it to peak about mid-April. You know, the weather changing helps a lot. So those are kind of the updates we have so far that that everybody's looking at. Don't forget the disaster rules that are out. They're posted to our website as well as DHS's website. Like I said earlier, don't listen to rumors. Verify through us, and we may not know the answer, but we will find the answer for you. Department of Health Services gets probably 3 or 4 emails a day from me right now. They're answering back as fast as they can, but keep in mind that everybody is pouring into that one building. Poor Dr. Chris. I mean, she's overseeing all of this. So it is getting crazy. We're here to support you. We're here for anything you need to know. Just reach out and let me know. Stay safe. Wash your hands. Sing happy birthday to yourself 2 times. And this, you know, it always makes me smile when I sing happy birthday to myself. And don't forget, wash your thumbs. Stay safe. Stay in. Infection control, most important thing right now. PPEs, infection control. Always err on the side of too much infection control than not enough. Talk to you guys later. If you need anything else, please reach out to me.